Today, let's explore how tools like artificial intelligence and augmented reality are integrating into mental health treatments, offering new ways to understand, monitor, and support mental well-being. This innovation goes far beyond just simplifying the work of professionals. It also aims to enhance access and personalize treatment, making mental health support more accessible and effective. We'll also delve into how these technologies could create a future where mental care is increasingly supportive, approachable, and integrated into people's lives. In recent years, technology has been part of a quiet revolution in unexpected areas, and psychology and mental health are among the fields where this transformation is most visible. Imagine, for example, the possibility of customizing an anxiety treatment tailored exclusively to an individual's needs, or having an AI system that helps monitor and identify symptoms before they become severe. Or even, imagine using virtual reality environments to simulate controlled situations, helping those with phobias confront their fears safely and gradually. One of the most innovative ways AI is transforming mental health is through treatment personalization. Unlike traditional methods, where a single approach is applied to many people, AI enables the creation of a treatment plan adapted to the needs and characteristics of each individual. This is achieved through advanced algorithms that analyze personal and clinical data, observe behavioral patterns, and suggest the best therapeutic practices for each case. A practical example of this is the use of apps that employ AI to recommend specific cognitive behavioral therapy techniques based on a personal history of anxiety. Suppose someone frequently logs a pattern of negative thoughts before bedtime. Upon detecting this behavior, the AI might suggest specific activities for the evening, such as deep breathing exercises or gratitude journaling, which help relieve stress and improve sleep quality. Furthermore, AI can adapt treatment as the person progresses. Instead of following a fixed plan, the AI reevaluates needs based on regular entries and well-being feedback, adjusting practices according to progress. For healthcare professionals, this personalization provides a precise tool that aids in therapeutic decision-making, helping them better understand how the patient responds to treatment and where adjustments might be needed. Another important advancement is the use of AI to predict and prevent relapses. For example, AI can analyze behavioral patterns in people with depression and identify signs that a patient is at risk of relapse. This could include changes in sleep habits, reduced social interactions, or a shift in the frequency of responses in a wellness app. Such analysis allows the professional to be alerted so preventive interventions can be made quickly, avoiding symptom worsening. These AI applications provide closer, more individualized care that not only enhances treatment efficacy but also enables rapid, targeted intervention. Thus, by personalizing treatments, AI helps ensure each person receives the most suitable support for their mental well-being. Artificial intelligence also plays a crucial role in continuous mental health monitoring, allowing follow-up to extend beyond traditional therapist sessions. Through apps and wearable devices, like smartwatches, AI can collect and analyze data in real time, identifying subtle changes in behavior and emotional state. This is especially valuable in conditions where symptoms fluctuate over time, like anxiety, depression, and bipolar disorder. Imagine an app that monitors aspects like sleep patterns, physical activity, heart rate, and even social interactions. When AI detects significant changes, such as irregular sleep patterns or decreased physical activity, it can interpret this data as possible signs of mental health deterioration. From there, the AI might send notifications with stress relief suggestions or, if necessary, recommend a consultation with a professional. Another example of continuous monitoring is voice analysis. Some AI apps can capture changes in voice tone and rhythm, which may be indicators of emotional shifts. For someone experiencing depression, the AI might notice a drop in enthusiasm in their voice or word choice, suggesting the person could be facing a challenging phase. This type of monitoring helps provide closer, less invasive care, ensuring mental health is observed over time without requiring frequent self-reports or clinic visits. This continuous monitoring becomes even more powerful when combined with reports and graphs that show progress over time, allowing people to track their own evolution. For example, they could see how stress levels relate to sleep hours, or how exercise impacts daily mood. For professionals, this detailed monitoring means a deeper understanding of factors affecting each patient. With AI, they can observe not only the patient's reports, but also consistent patterns that reflect the impact of therapeutic practices. This leads to faster follow-ups and more efficient treatment, enabling precise interventions that promote ongoing well-being. Augmented reality and virtual reality are revolutionizing psychotherapy by providing immersive experiences that help treat phobias, traumas, and anxiety in a controlled and safe manner. These technologies allow patients to face uncomfortable situations without needing to be physically exposed to them. Through simulated scenarios, therapists can observe and guide the patient, providing a controlled environment that facilitates gradual and progressive confrontation of fears. A common example of using virtual reality is in therapy for people afraid of flying. Instead of exposing the patient directly to a plane trip, virtual reality creates a realistic simulation of a flight, with all the sounds and movements someone would experience. In this way, the patient can learn to manage their anxiety in a controlled setting while the therapist observes and assists, helping them understand and process their emotions without the risks of the real experience. Beyond phobias, augmented reality and virtual reality have been used to treat post-traumatic stress disorder. For individuals who have experienced trauma, these technologies offer a safe space where they can therapeutically revisit painful memories, with direct professional support. Through virtual reality, patients can recreate specific scenarios and work, little by little, to desensitize their emotional responses to these memories, promoting recovery. Another promising area is the use of augmented reality and virtual reality for mindfulness and meditation practice. For people who struggle to relax or focus, these virtual environments can simulate tranquil spaces, like forests, beaches, or mountains, aiding in the process of mental calm and focus. These virtual practices make it easier to learn meditation techniques and help create a more effective routine for managing stress and anxiety. With these technologies, psychological treatment becomes more engaging and adaptable, better meeting the needs of each individual. Using augmented reality and virtual reality in psychotherapy allows treatment to be as close to reality as necessary, but with the safety of a supervised environment. This expands possibilities for those who wish to face emotional challenges in an active, structured way, providing an experience that is both therapeutic and transformative. Another exciting innovation in mental health is the use of avatars and AI-guided therapies. With the help of digital avatars, people can engage in virtual therapy sessions with a figure representing the therapist or a therapeutic assistant. These avatars can be particularly useful for individuals who, for various reasons, have difficulty opening up to others or feel more comfortable speaking with a digital presence, helping them express emotions and thoughts without the discomfort of face-to-face interaction. The avatars can also be programmed to respond empathetically, acknowledging concerns and providing support based on therapeutic practices. This type of interaction may seem simple, but studies show that many patients benefit from the feeling of being heard, even if the avatar is AI-powered. Moreover, AI can adjust the avatar's responses based on the patient's specific needs, creating a welcoming, safe environment in which the patient feels comfortable exploring their feelings. Another promising aspect of this technology is AI-guided therapy, which combines data analysis and advanced algorithms to suggest therapeutic interventions. For example, an AI that detects signs of prolonged sadness in a person might offer activity suggestions or reflective questions to help address these feelings. This provides an interactive, continuous therapeutic experience, complementing in-person or online sessions with a human therapist. The combination of avatars and AI offers accessible, on-demand therapeutic support, promoting more consistent care and ensuring the patient has someone to talk to whenever needed. Digital mental health platforms are playing a fundamental role in making psychological support accessible to a broader audience. Through apps and online platforms, people can access mental health support services quickly and, often, at a more affordable price. This is especially relevant in a context where many regions lack mental health professionals, and not everyone can afford regular therapy sessions. These platforms offer a wide range of services, from therapy sessions with professionals to self-care and self-help programs that allow individuals to explore techniques to improve their well-being. Many apps include mood journals, guided meditations, and breathing exercises, providing a practical and easy way to monitor mental health daily. There are also online support forums where users can share experiences and seek guidance, creating a sense of community and mutual support. For those just beginning to explore mental health care, these platforms offer a less intimidating first step. For example, a user might start with simple breathing exercises or self-compassion sessions guided by AI before progressing to more intensive therapy if needed. This flexibility encourages many people to seek help, especially those who may feel apprehensive or stigmatized by conventional psychological treatments. With expanded access, digital platforms also promote inclusion, ensuring more people, regardless of location or financial situation, can care for their mental health. This marks significant progress in addressing mental health inequities, bringing therapeutic resources closer to those who need them most and fostering a culture of care and mental well-being for all. While applying technologies like AI and digital platforms to mental health brings significant advancements, it also raises important ethical challenges. A primary concern is data privacy. Since these technologies rely on collecting and analyzing personal data, there is a significant risk of exposure and misuse of sensitive information. Mental health data is highly private, and ensuring it is protected and only accessible by authorized professionals is essential. This requires tech companies to invest in rigorous, transparent security systems with clear, respected privacy policies. Another point to consider is the role of human therapists. With the rise of AI-guided therapies and digital avatars, it's crucial to question the extent to which these tools can replace the sensitivity and empathy a human professional offers. AI is excellent at detecting patterns and suggesting interventions, but it lacks the emotional understanding a human interaction provides. It's vital that these technologies are seen as complementary, not replacements for human therapy, so that the emotional support offered remains comprehensive and respects the nuances of interpersonal relationships. Additionally, there is a risk of technological dependence, especially when people come to rely entirely on apps or devices to monitor their well-being. In the long term, these resources should promote autonomy and self-awareness rather than creating dependence, which could impact the development of personal skills for managing emotional challenges. Unequal access to technology is another challenge. Many people, especially in low-income areas, may lack access to the technological tools needed to benefit from these advancements. Therefore, for technology to truly transform mental health inclusively, it is essential to consider ways to make these resources available to everyone, promoting broad and fair accessibility. Technology is opening new paths in psychology and mental health, bringing tools like AI, augmented reality, and digital platforms to enrich and expand emotional well-being care. These innovations offer personalization, accessibility, and continuous monitoring, helping make treatment closer and more effective for each person. However, it's also critical that these technologies are used responsibly, respecting privacy and promoting inclusion. With a balance between innovation and ethics, the future of mental health promises to be more supportive and accessible, benefiting even more people worldwide.